What colorectal cancer screening method should I get? Deciding on the best way to screen for colorectal cancer can feel overwhelming, but understanding your options helps you make an informed choice. Colorectal cancer develops in the colon or rectum and often begins as small growths called polyps. Detecting these early is key to prevention and successful treatment. The most common screening methods include colonoscopy, stool tests, and imaging procedures, each with its own benefits and considerations. A colonoscopy is considered the most thorough screening tool. It allows doctors to view the entire colon and rectum using a flexible tube with a camera. During the procedure, any precancerous polyps can be removed, reducing your risk of developing cancer later. For people at average risk, a colonoscopy is usually recommended every 10 years. If you have a family history of colorectal cancer or other risk factors, your doctor might suggest more frequent screenings. While colonoscopy is highly effective, it does require bowel preparation and sedation, which some find inconvenient or invasive. Fecal immunochemical tests are non-invasive and simple to do at home. They check for hidden blood in your stool, which can be a sign of cancer or polyps. These tests are recommended annually and are convenient because they don't require bowel prep or sedation. Although they are less sensitive than colonoscopy, they are a good option for those who prefer less invasive screening or need a more accessible approach. Fecal occult blood tests are similar to the immunochemical test but use a different method to detect blood in the stool. Like the FIT, they are recommended yearly and are easy to perform. These tests are useful for initial screening but may need to be followed up with a colonoscopy if results are positive. Fecal DNA tests, such as Colorectal, combine detection of blood and abnormal DNA shed by cancer or polyps. They are usually done every 3 years and offer a balance of sensitivity and convenience. This test can be a good choice for those who want less frequent screening but still want a reliable method. Computed tomography colonography, also called virtual colonoscopy, uses X-ray imaging to produce detailed pictures of the colon. It's recommended every 5 years and is less invasive than a traditional colonoscopy. However, if polyps or abnormalities are found, a traditional colonoscopy will still be needed to remove or biopsy them. Sigmoidoscopy examines only the lower part of the colon and is typically recommended every 5 years. When combined with annual stool tests, it can be part of a flexible screening plan, especially for those who prefer less invasive procedures. When choosing a screening method, consider your personal risk factors, such as family history or previous health issues. Think about what feels most comfortable and manageable for you. It's always best to discuss these options with your healthcare provider, who can help tailor a screening plan based on your individual health profile. Regular screening is vital for early detection and prevention of colorectal cancer, so working with your doctor ensures you get the most appropriate and effective screening for your needs.